Americans, welcome to the Ed Show on MSNBC tonight. Here's some new material. The public option is now responsible for unemployment and the never-ending war in Afghanistan. That's the newest righty talking point. Here's Minority Whip Eric Cantor this afternoon on that.
Healthcare in this building has now made it so that we cannot seem to get anything else done. We've got burning issues out there in this country. First and foremost is the fact that Americans want to see job security return. They want to see economic security return. But somehow we're unable to deliver on that because of the intransigence on the majority's part on even discussing ways for us to agree on health care. We've got serious challenges as far as Afghanistan is concerned. That's being clouded by the rigidity with which this majority hangs on to H.R. 3200 and the imposition of a public option.
There's just so much to do. We can't do it. Eric Cantor's suggestion that if the public option were off the table, heck, all the Republicans, they'd be on board with health care reform. And another lie. The Republicans want one thing, do not forget this, my friends, and that is failure. They will blame the public option until the public option is dead, and then they'll blame something else. They want to dismantle reform. They'll never work with the Democrats on this. Now, here's another dandy from Mr. Cantor himself. Just a couple of days ago, the congressman holding one of his only health care town hall in the state of Virginia, a woman named Patricia Churchill stood up and told this story. Here it is.
I have a very close relative, a woman in her early 40s who did have a wonderful, high-paying job, owns her own home, and was a real contributing member of society. She lost her job. Just a couple of weeks ago, she found out that she has tumors in her belly and that she needs an operation. Her doctors told her that they are growing and that she needs to get this operation quickly. She has no insurance.
I guess I would ask what the situation is in terms of income eligibility and the existing programs that are out there. Because if we look at the uninsured right now, there is probably 24% of the uninsured that is already eligible for an existing government program. Beyond that, I know that there are programs, there are charitable organizations, there are hospitals here who do provide charity care.
That is a classic, my friends. Did you get all of that? A woman's got stomach issues. She's got cancer. She needs surgery now. This is a classic because when you present the Republicans and the obstructionists with a real-life scenario, they don't have an answer. They're still talking percentages. How would you like to be in the percentage where you're left out? You're just SOL. That's their reform. That's their answer. You know, they're great at holding up the socialism, the communism, the Marxism, all kinds of isms, but they don't have an answer for that woman. She's just at the wrong spot at the wrong time. And we got to talk about the redistribution of wealth. You know, I was watching the UN coverage today here on MSNBC and all the speeches that were given. And they took a wide shot of all the different diplomats and leaders of the countries that were there. And I wish I had gone over there with a camera and done an international man on the street or leader on the street and asked them if they do health care in their country the way we do it here. But I know the answer. It's no. We like to butcher people who have got cancer that don't fall in the correct percentage point. So here's my point. Americans, you can't trust Eric Cantor. Cantor's response speaks volumes about how inept the Republicans are and how they are simply not solution-based. Charity? Is that what he said? This woman can't get a government program. She's in her early 40s. She's too young for Medicare. She doesn't qualify for Medicaid. But there's always charity. Or what the heck? You can go to the hospital and plead your case and say, well, you know, I'm broke. Cantor should know that there's no such thing as a free lunch in health care. The hospital passes the cost on to the other patients, or they pass it on to the insurance companies, and then they pass it on to you and me in some form of a higher premium. And that's how the hell we got started in this whole debate in this country in the first place about health care reform. Hold it right there. The Republicans lie. They want to see you dead. They'd rather make money off your dead corpse. They kind of like it when that woman has cancer and they don't have anything for her. That's how the insurance companies make money, by denying the coverage. My God, Democrats, what's wrong with you? You can't deal with these people at all. But it's socialism. But it's about taxes. Let's get to the larger issue here. Cantor thinks that there are more important issues than a life or death thing for that woman. You know, there's the pressing issue of amendments over on the Senate side that he hasn't said anything about, like, hey, man, let's go after Acorn. What do you say we make sure we don't have any czars at health care reform? The folks on the Senate Finance Committee, they don't get it either. Here's Senator Olympia Snowe asking for what? The September stall again.
If it takes 2 more weeks, it takes 2 more weeks. I mean, we're talking about trillions of dollars in the final analysis. I do not understand it. What is the rush? What is happening in 2 weeks? Is there something happening in 2 weeks that we cannot wait? Is it the Columbus Day recess? What is it? Because I'm not quite clear. I want to do my job. And our job is to sit here and do it as long as it takes.
Do it and watch people die. That's the Republican way. Why can't we delay? Senator Snowe, what part of this didn't you get?
She has tumors in her belly and that she needs an operation. Her doctors told her that they are growing and that she needs to get this operation quickly. She has no insurance.
2 weeks matters a lot. Now, Olympia Snowe, I'm not wishing bad on you at all, but if you get cancer in your stomach, Senator Snowe, what I would like you to do is wait 2 weeks to see a doctor. Huh? You're telling them to suck it up? This is a moral issue. We've got to act on this now. There has got to be a cure for this woman in the greatest country on the face of the earth. Are we the greatest country on the face of the earth when it comes to health care? I don't buy that. I think we can do a lot better. And here's what the Republicans and all the righty talkers and all these psychos on TV do. What they do is they play to your fears as if somebody's going to come take something from you. The President of the United States is trying to make it right. And the Republicans are fighting him tooth and nail on this.
I'm not a crook.